Try this before you take another long walk today. Lie flat on your back, bend one knee, and gently press the back of your other knee into the mattress. If that feels like effort, your legs may be telling you something walking alone can't fix. For more than 2 decades, a joint specialist working with adults over 65 has watched a strange pattern play out again and again. Patients faithfully walk every single morning believing they're protecting their bodies, only to end up more sore, more stiff, and more discouraged than when they started. Here's the uncomfortable truth nobody tells you. If your joints are already worn, if arthritis or balance trouble or chronic knee pain are part of your daily life, pushing yourself to walk further can backfire. It can leave you inflamed instead of strengthened. But there's a quieter alternative that rehabilitation experts increasingly rely on. A set of 5 low-impact movements, done lying safely in bed, that wake up the same major muscle groups walking depends on, without loading your knees, hips, or lower back the way walking does. Stick around, because the exercise at number 1 is the same one many physical therapists teach patients right after joint surgery, before those patients are even cleared to take a short walk. Every movement here comes from established rehabilitation guidelines. Nothing invented, nothing exaggerated. And as always, check with your own doctor before changing anything about your movement routine, especially if you're recovering from surgery or managing a joint condition. Let's start at number 5, the straight leg raise. Ask 100 rehab specialists for the single best bed exercise to reawaken tired thighs, and a large share will name this one first. The reason is simple. Your quadriceps, the muscles along the front of your thigh, are essentially your engine for standing up, climbing stairs, and catching yourself when you stumble. They also fade faster with age than almost any other muscle group. When they weaken, your knees can feel like they're going to give out, rising from a chair becomes a small battle, and stairs start to feel genuinely unsafe. This move targets those muscles directly, with zero motion at the knee joint itself, which is exactly why it's so useful for anyone with arthritis or sensitive knees. Lie on your back, bend one knee with the foot flat on the bed as an anchor for your lower back, and keep the other leg straight. Before lifting, tighten the top of that straight thigh by drawing the kneecap gently toward the hip. Skip this step, and you risk straining the hip instead of building the thigh. Then raise the leg roughly 12 inches, hold 5 seconds, and lower slowly over 3 to 4 seconds. Aim for 8 to 10 lifts per leg, 2 sets, once daily to begin. The most common mistake is letting the knee bend or using momentum to jerk the leg upward. The instant that happens, the quadriceps stop doing the work. Number 4 is one people almost always underestimate: ankle pumps. They sound too simple to matter, but they're the quiet mechanism that makes everything else on this list work better. When you sit or lie down for long stretches, blood tends to pool in the lower legs. Your calf muscles act as one of the body's key pumps, pushing blood back toward the heart. When that pump goes quiet, legs feel heavy, tingly, and undernourished. Of the fresh circulation muscles need to strengthen. Lie flat, legs extended, a small pillow under the knees if that's more comfortable. Point your toes away from you and hold 2 seconds, then pull them back toward your face and hold another 2 seconds. That's 1 repetition. Speed ruins this exercise. Done quickly, it's meaningless. Done slowly, the calf genuinely has to work. Aim for 15 to 20 repetitions, ideally in the morning, afternoon, and before bed. For extra benefit, consciously squeeze the calf as you point the toes, as if pressing the ball of your foot into something solid. Now to number 3, the heel slide. A smooth, flowing movement that rebuilds the muscles around the hips and knees while keeping you completely supported. What makes it valuable is how closely it mirrors real life. It blends hip and knee bending in one motion, the same pattern your body uses every time you rise from a chair or step out of a car. Lie flat, arms at your sides. Starting with your stronger leg, slide the heel slowly along the bed toward your buttocks, keeping it in contact with the surface the entire time, bending the knee as you go. Pause 3 seconds near the top, then slide back down slowly. Do 10 to 12 repetitions per leg, 2 sets, once or twice daily. This is especially good for arthritis, since the gentle bending keeps the knee joint moving without putting weight through it. Avoid letting the heel lift off the bed, and avoid rushing. Aim for about 4 seconds in each direction. For an added boost, gently squeeze the thigh as the heel slides upward, pulling the quadriceps into the movement alongside the hip muscles. Here's the one that tends to surprise people most: Number 2, the quad set. There's no visible movement at all. No lifting, no bending, no sliding. Yet rehabilitation specialists reach for it constantly, especially when someone is too weak or too sore for anything more active. This is an isometric contraction. You tighten the muscle hard while it stays completely still. When legs are very weak, gentle motion alone often doesn't fully activate the deep muscle fibers responsible for real strength. A strong, focused contraction does. Lie flat, legs extended, an optional rolled towel under the knees. Working one leg at a time, press the back of that knee firmly down into the mattress as if flattening something beneath it. You'll feel the top of the thigh tighten. That's the quad set. Hold as hard as comfortably possible for about 10 seconds while breathing normally, never holding your breath, then release for 5 seconds and repeat. Do 10 contractions per leg, 2 sets, twice daily. The whole routine takes under 10 minutes. The most common errors are pressing too lightly, releasing before the 10-second mark. Deep activation builds mostly between seconds 5 and 10, or doing both legs at once instead of giving each side full focus. For extra engagement, point the toes back toward your face while pressing, which draws the shin and calf into the contraction too. And finally, number 1, the glute bridge, the movement that ties everything together by activating one of the most powerful and most overlooked muscle groups in older adults, the glutes. Few people connect glute strength to leg function, but physical therapists have long understood that the glutes act as the engine for the entire lower body. When they're weak, the knees, hips, and lower back are forced to compensate for work they weren't built to do, wearing out faster as a result, a major reason so many older adults deal with aching backs, unstable hips, and real difficulty rising from a low chair. When the glutes are strong, walking feels lighter, standing feels simpler, and balance noticeably improves. Strong glutes function as a kind of built-in fall prevention system. To perform it, lie on your back with knees bent, feet flat about hip-width apart, heels roughly 6 inches from the buttocks, arms resting at your sides. Press firmly through the feet, especially the heels, squeeze the buttocks hard, and lift the hips until knees, hips, and shoulders form a straight line. Don't lift beyond that point, since going higher only stresses the lower back. Hold 5 seconds at the top with the glutes squeezed, then lower slowly over 3 to 4 seconds. Aim for 10 to 12 repetitions, 2 sets, once daily. The most important cue, lead with the glutes, not the back. If you feel it in your lower back, you're compensating incorrectly. Keep the knees pointing forward rather than collapsing inward, and breathe out as you lift, in as you lower. For a stronger effect, press slightly harder through the heels than the toes to bring the hamstrings in, with one extra firm squeeze at the very top. Together, these 5 movements cover circulation, strength, mobility, and stability, the 4 areas that decline most with age and the ones that most determine long-term independence. The straight leg raise wakes the thighs, ankle pumps restore circulation, heel slides retrain the everyday motion of standing, the quad set rebuilds strength when nothing else feels possible, and the glute bridge powers the entire lower body. You don't need to do all 5 tonight. If you can only manage one, start with the quad set. It's the gentlest entry point and one of the most effective. Add the others gradually as strength builds, because at this stage of life, consistency beats intensity every time. 5 honest minutes done regularly will do more for you than an exhausting routine you can't sustain. If this was helpful, consider following along for more content like it, and share it with someone who might need it too. And as always, talk with your own doctor before starting any new exercise routine, especially if you're managing a joint condition or recovering from an injury.